Welcome, everyone. Thank you for those who joined early. We're going to start in a few minutes. Please stand by. And in the meantime, we can take a look and see that we're actually broadcasting. Yes, and it appears that we are on LinkedIn. And probably others as well. Again, welcome to those who just joined a bit early. We're going to be starting in a couple of minutes. Okay, one more minute and we'll get started. Great. Well, thank you all for joining. Hello, my name is Alex Morozov. I'm an oncologist, former pharmaceutical executive. I always like to start with that. And the CEO and founder of Eviva Partners, a nonprofit promoting better understanding of evidence to improve medical decision-making and reduce care gaps. Our focus is broadly on health, from prevention to screening, diagnosis, treatment, follow-up. But recently our attention, as I'm sure for many of you, has been drawn to autism since in April, the US Department of Health and Human Services announced a grant competition to identify the cause of the autism epidemic. And we even heard that some results may be expected as early as this month. So, in anticipation of this announcement, we organized this panel to talk about this idea of an autism epidemic. Um, we'll talk about the term, who coined this term, and how it came to be, and whether other countries use this term as well, in addition to the US. We'll talk about whether autism is a new phenomenon. And there may be some suggestions that it's a new phenomenon that perhaps didn't exist before the 1980s. We'll talk about that idea. And then even the question of whether autism is a disease that requires a cure. And could, in fact, autism be what makes us human? And we'll make sure that we have some time at the end for Q&A. You can submit your questions by text to this number, 205-618-1059, and we'll monitor and direct questions to our distinguished panel. And I'm so excited and truly honored that we have such a distinguished panel today. Dr. Mitzi Waltz is a distinguished disability historian and scholar of media and cultural studies with a strong focus on autism and developmental disabilities. She's at the Vrije Universiteit Amsterdam, and I'm sorry, I'm totally butchering that. And most recently, she's the author of the book Autism as Social and Medical History, which is now in the second edition. It's an incredible book that offers a rich account of how societal and medical narratives around autism have evolved. Dr. Gil Eyal is a professor of sociology at Columbia University and directs the Trust Collaboratory. Hopefully, in one of the future discussions, we will hear more about this and your interests in generally in expertise and trust. And there's for all of the panelists, there are a lot of follow-up conversations that we could have in the future. He's exploring the complex relations between expertise, science, and democratic governance. And he's the author of multiple books, including The Autism Matrix, which is very relevant to today's discussion. Dr. David Mandel is the director of the Center of Mental Health and associate director of the Center for Autism Research at Children's Hospital of Philadelphia at the University of Pennsylvania. His work focuses on improving care quality and health equity for individuals with autism and other developmental and psychiatric disabilities. And unfortunately, Greg Robinson could not join us. He's not feeling well today. And we tried to get a last-minute replacement from ASAN, the Autistic Self-Advocacy Network, and they tried, but it was too short of a notice. But we do have some remarks that we'll make on their behalf, and they certainly assured us that they will be here for any follow-up discussions. Colin Killick, who is the president, was very helpful, even from hiking in a national park this morning to provide some remarks and try to find the replacement. So huge thanks. And I hope we do have Greg on a future in the future discussion. He's the Director of Public Policy at the National Office of ASAN, Autistic Self-Advocacy Network, which is a leading autism advocacy organization. His policy work centers on the intersection of social determinants of health and disability equity within marginalized community. So welcome to all of you. If it's okay, I'm going to use first names for this discussion, just for simplicity. And Mitzi, my first question is for you. Can you talk about this term autism epidemic and how it was coined? I was you have such a unique experience having been in some of the early meetings and hearings and the discussions and having met some of the stakeholders.
I had to have a think about this question because it came up when we spoke earlier. I thought, where did I first hear it used? And I am pretty sure that the very first time was in the 1990s on Autism L. Autism L was an online discussion group for parents. There were also a few autistic adults there, at least for a while. And unfortunately, it was also infested with every kind of snake oil salesman that you could possibly ever want to meet. There were anti-vaccination voices in that forum from early on, and they were the ones who were really pushing this idea of the numbers are way up, what's going on? They often urge parents to read a book called A Shot in the Dark, which came out in 1985 by anti-vaccination crusaders. It was about an early version of the diphtheria vaccine, and there were some problems with that vaccine, but those problems didn't extend to every vaccine, and they were very quickly dealt with. The authors alleged that this vaccine had caused some rare cases of brain damage, and those who pushed the book were really keen on placing autism as a form of brain damage. That was kind of the message. It's an epidemic. It's an epidemic of brain damage. It's been caused by vaccines. Some people would have other ideas about what caused it. But yeah, they were not alone in that belief. There was a guy called Glenn Doman who was around back then. He was a physiotherapist, and he had been pushing this idea that there was sort of an epidemic of neurodevelopmental conditions in general. He started working with people with cerebral palsy, but he very quickly kind of broadened out to there are all these things, they're all being caused by brain damage. So there was fertile ground there when this idea came up. Now, when my autistic son was born in 1990, because I'm also a mom, there was very little mainstream information for parents. So we really reached out to groups like Autism L. To give you an idea of how little, our public library in Portland, Oregon, which is a fairly big city, had 2 books about autism on its shelves. One of them was The Empty Fortress by Bruno Bettelheim, which was just full of pseudoscientific nonsense. And the other one was Uta Frith's Autism Explaining the Enigma, which unfortunately didn't, but it did get me kind of going on autism history. I got very excited by that book and reached out to her, and we eventually became colleagues, which is great. Now, Bettelheim's view was autism was a psychological disorder, and that view was still very much in the air at that time. And that meant most clinicians you saw in 1990 didn't have much to suggest, and your insurance wouldn't cover much. So my son was nonverbal for about 5 years, and he only got 6 weeks of speech therapy because that's all our insurance would cover. It was super helpful. They did a lot. It helped him, but he really could have used more. Instead, we were instructed to take him to play therapy, where therapists tried to cover, whatever non-existent trauma had caused his autism, which was a waste of his time and ours. The other option was applied behavior analysis, which was 40 hours a week of trying to force your child to act like other children. And I thought that was just cruel and expensive. And we also know it doesn't work. Or there was this other path, and it was a lot more accessible, and you found it a lot more on places like Autism L, and that was alternative medicine. And in the autism world, they used the term biomedical interventions, which also sounded very science-y, right? I'm going to do biomedical interventions, even though I'm not a biomedical expert of any sort. I'm just a mom. At that time, I was a mom and a journalist, had nothing to do with autism research. Now, mainstream clinicians that you saw painted a very dark future for your child. And so did the people who pushed ABA, and so did the people who were pushing these other alternative treatments. There was a lot of pressure to do something, do anything, because otherwise your child is going to be institutionalized and it's going to be terrible. And there were lots of people happy to sell you something. And to do this, they needed a sales pitch. And Autism Epidemic was a key part of that sales pitch. This is where we get into the political side, right? There's a guy called Dan Burton, who was a senator. And Dan Burton was one of the first people on the public stage outside of parent forums to be using this term, autism epidemic. But he didn't get it out of nowhere because Burton had been an alternative medicine champion from very early on in his career, not just about autism. He had been an advocate for homeopathy, for vitamin injections, for herbal medicine, and all of this stuff. And I don't want to run all of it down because, anyone who works in medicine knows that some of these complementary and alternative practices are actually evidence-based now. There's been good research for some of it, like ensuring that people being treated for cancer also get psychosocial support. That's crucial. But a lot of it is absolute woo, and it's big business. In the early 2000s, Burton started to get fairly big contributions from sources like the American Chiropractic Association and lots of smaller ones from individual alternative medicine practitioners. So I think it's kind of natural that he would be the guy to introduce the concept of an autism epidemic into a congressional hearing. And that word epidemic, just like it worked on parents as a sales, also got the attention to fund research for people who wanted to investigate their hunches about vaccines and specific interventions. And maybe another thing to remember about Senator Burton is that he was very much a creature of the far right. He was vehemently opposed to the ADA, for example, the Americans with Disability Act. He actually distributed a flyer during the ADA hearings. I'd forgotten about this. I had to go find it. He called the bill, and I quote, "the last-ditch attempt of the remorseless sodomy lobby to achieve its national agenda before the impending decimation of AIDS destroys its political clout." So he had his agenda. Autism epidemic fit that agenda. And yes, the rate of diagnosis was going up, but I think there's people here besides me who can say a lot more about that and how that worked, what it was about, which parts of diagnosis have increased, etc.
Well, thank you. We are off to getting right into the thick of it. Yes, no, this is incredible, and I was also fascinated when I discovered that the term autism epidemic was not coined by a scientist or an epidemiologist, but actually, as you said, it was publicly first, announced by a politician in the U.S. Any thoughts on how other countries begin to adopt that term around that time?
Oh, yeah. Diagnostic rates are indeed going up all over the world. I mean, wherever you look, you'll find that. That's not news. And it's because we're a lot better at diagnosing now, and we diagnose a much wider group. But screening for symptoms finds about the same rate of symptoms everywhere if you screen. And then the rate of diagnosis rises to meet that eventually when you have services available. And I think Dr. Ayal will say a lot more about that. But we do see the term used everywhere where we see that same dynamic at play. Somebody needs money to fund research, so we're going to use the term, it's out there. Someone has something to sell to you, and they want to use a scary word, epidemic, to sell it. You can see that in lots of countries, including in the Netherlands where I work. It's certainly out there. Whether it's accepted by the mainstream medical system or the government, that can be different in different countries. But the term has circled the world, just like every other idea does these days through the internet.
Thank you. Now that's any comments from David, Gil? Any comments from your side before we move on to the next question?
I will say that in the United States, in early 1990s was the first time we started to have any administrative count of people on the autism spectrum, because through the advocacy of a lot of really hardworking caregivers and parents, it got its own category in special education. And so we didn't have any administrative count before 1990, nor was there a reason to assign the diagnosis in terms of increased access to services or supports. And so once we did that, there was a lot more rationale for the diagnosis within the education system. And a lot of when people talk about, quote, the autism epidemic, the numbers we had were those numbers in the special education category of autism, which were going up as we would expect in the early 90s through the mid and late 90s, because we were finally tracking and because we were finally offering supports in a way we hadn't before.
Thank you. Thank you. So this maybe is a good segue into kind of the timeline of this phenomenon. And maybe, Gil, I would love to ask you about this idea that autism did not exist prior to the 1980s, or it was extremely rare. And in fact, even this idea that this specific quote unquote red line that started in 1989 when it really took off, and I wasn't sure the source of that year until I found there's a talk by Andrew Wakefield, of course, who is the disgraced British doctor who was stripped of his license for unauthorized experiments on children. He gave a talk in 2011 where he talks about this and quoting a couple of studies that have that clear sort of takeoff in 1989. Is there any merit to this idea?
No. I mean, the short answer is no, and now I'll give the long answer, which I think David actually already touched on. But actually, this cutoff, 1989, undercuts, pun intended, the Wakefield or the RFK argument, because it supports the argument that the rise in the number of diagnoses is due to diagnostic change. So, what people need to understand is that diagnostic criteria for autism have changed significantly over time. Originally, they were very, very strict. For example, they require the presence of a quote-unquote cardinal symptom of autistic aloneness and utter lack of interest in people to get the diagnosis. Or it was a truism that, at least, during the 60s and 70s, that all children with autism engaged in self-injurious behaviors like rocking and banging of head. So when you have that as the criteria, you're going to diagnose very few kids. And that was an essential part of the diagnosis. And the true broadening of the diagnostic criteria happened in 1987 with DSM-3R revised. Instead of aloneness, autism was diagnosed as a spectrum of impairment of social interaction that can range, from obviously utter disregard of people to, sort of like disrupted social interaction, things that are much milder than that. And self-injurious behaviors became just an associated feature, not necessary for diagnosis. In DSM-4 in 1994, they were completely not mentioned anymore. So you can see that this relaxation of diagnostic criteria could have led to an enormous increase in the number of diagnoses. Now, in my research, I also found that the number one sign that leads parents to seek diagnosis is speech delay. Now, when do you start worrying about speech delay? Around the time a child is 2. This is when you start worrying, though you may only go to diagnosis later. So there you have it, 1987 to 1989, 2 years. I mean, that's a little bit simplistic, but it puts the lie to this whole argument about a red line or a cutoff or something like that. Now, you could say maybe the diagnostic criteria would change just in time to respond to something that clinicians were seeing in their offices. Well, if you know the history of how the diagnostic criteria were changed, you know that there's absolutely no merit to this argument or to the speculation. The criteria that were included in the 1987 DSM-3R were adopted from an earlier article in 1979, so 8 years earlier, by Lorna Wing and Judith Gould. Now, this new criteria included especially the idea that autism is a spectrum of impairments of social interaction. They came from the parents of children with autism. Lorna Wing was a psychiatrist, but she was also a mother of a daughter with autism and the president of the British Parents Association. Parents in the UK and the US read Hans Asperger's articles and began lobbying already in the early 1970s for the diagnostic criteria to include more high-functioning forms of autism. But it took a long time until that was adopted into the DSM. So that's a very significant fact. I'm emphasizing this so you'll understand that there were a lot of children probably with autism before 1989, but they were undiagnosed. And their parents were pushing for different diagnostic criteria that will recognize what their children had. So we need, in fact, to completely invert the question and the way we tell the story. Instead of asking why autism is more prevalent now or why the numbers start to rise in 1989, you need to ask why was it rare in the past? Why between 1943, when the diagnosis was first formulated, and 1989, the rates were relatively low? This question directs attention to the conditions that are necessary for autism to be identified, differentiated, and diagnosed on a large scale. These conditions are not given. They don't always exist. You have to actively construct them, as David already alluded to. When you are faced with a small child who doesn't speak and doesn't respond, do you have the wherewithal to do differential diagnosis? Now, posed in this way, the answer seems obvious in retrospect. Now, if you go back to the 11 kids that Leo Kanner wrote his original article about in 1943, the 11 kids he saw, they were brought to him because their parents, who were all, by the way, upper middle class professionals, disputed the diagnosis of feeble-mindedness that was given to their children. Feeble-mindedness was the term that later was changed to retardation, and now we call it intellectual disability, etc. Now, in 1971, Kanner did a follow-up study of these children. He found 4 of them who spent their lives from 43 to 71 in institutions for the retarded, as they were called at the time. Now, if this was true for children with elite parents who saw the only child psychiatrist who at the time was diagnosing autism, what chance in hell did the others have? No chance at all. So I think it's fairly safe to say that many kids who today would have qualified for an autism diagnosis were diagnosed with mental retardation and institutionalized. In fact, we have many testimonies from the period from 1950 to 1980 who say exactly this, that there are many autistic children in the institutions. Bernard Rimland, who was among the founders of the American Parents Association, said this in 1964. He had the option to institutionalize his son Mark, but he declined. The crucial point is that in a large state institution, which was residential, it was impossible to differentiate autism from other conditions. In the institution, autism was beneath the radar because the institution produced autistic symptoms on a massive scale: withdrawal, indifference, self-stimulatory behaviors. These are all common reactions to institutional environments that you see not only in these institutions, but also in prisons and in hospitals, etc. So that's why in my book, I emphasize that the real reason for the rise in the numbers of autism diagnosis is the deinstitutionalization of mental retardation. It created the conditions within which autism could be identified, differentiated, and diagnosed on a large scale, not only because the children now are home, but also because with this deinstitutionalization came legislation, David referred to it before, that established early intervention programs, special education programs, within which the distinction now was meaningful and relevant. Now, to understand the impact of deinstitutionalization, we do have to get rid of the image that we have of the institutionalization that is taken from the case of the deinstitutionalization of mental illness. When we hear the deinstitutionalization, we hear dumping, but that was not the case with the deinstitutionalization of mental retardation. It was not achieved by sending people out of the institutions and closing them. It was achieved over a long period of time, from the mid-70s to indeed the early 90s, by preventing the institutionalization of young children. No longer were young children sent to institutions. That was the big difference. Another big difference from the institutionalization of mental illness is that it didn't come with, fiscal constraints. On the contrary, you actually had some increases in expenditures with the institutionalization. So there you have it. The rising level of autism diagnosis from 1989 onwards is because finally the conditions necessary to make differential diagnosis were present, and because we actually cared to make this diagnosis. We think it is significant and relevant to unlocking the potential of individuals, however different they may seem.
Mm-hmm. Thank you. And sorry, can you clarify the last point on the fiscal constraint? I didn't quite get that.
So what happened with the deinstitutionalization of mental illness is that there was savage cutting of budgets for the treatment of mental illness, and especially for state residential institutions. California is notorious for that. It happened under Reagan when he was the governor, because these are state residential institutions. They are funded mostly by state funds, and they get federal funds too. There was a savage cutting, which basically meant that the number of beds you could have was minimized, and a lot of people were let out. In the case of mental retardation, there is research out of, I forget the name of the Institute in Minnesota that has done great work on the statistics of the deinstitutionalization of mental retardation. But they show that the process of deinstitutionalization was not like closing institutions and cutting budget. It was closing institutions that were, cesspools, like Willowbrook, we talked about it, building new and smaller institutions that sometimes were community houses and sometimes were, organized differently, and investing in that. And also, obviously, investing in early intervention and special education programs. Now, I don't want to make this too much, it's still an underfunded, woefully underfunded area, and should get more funds, but it was not the same process. It's a process in which actually states, at least, and you can see states in the Northeast and the north of the country, Minnesota, Wisconsin, etc., you could see them channeling more funding at this.
Thank you. Yes, and I actually, perhaps for a future discussion, I did have a chance to speak to the mother of a young girl who was at Willowbrook, who was diagnosed with autism in 1960s in New York. That was the time when, the mother was told, because you were cold, that's why your daughter developed autism, just the heartbreak and that alone. But then, unfortunately, because the girl was required 24/7 observation so that she wouldn't hurt herself, the family was not able to provide, and there were so few services at the time. She was fired from multiple facilities, and eventually they had no choice. They had to bring her to Willowbrook. And unfortunately, what's even more horrific, she was subject to the hepatitis experiments that were being conducted at Willowbrook at that time.
Mhm.
But now she's in her 50s, and she lives in kind of a home. I think she has two or three other roommates with 24/7 care. Sometimes they can have jobs, and she gets music therapy, etc. So here's one example that I think exactly illustrates your point. And of course, a lot of those services could be on the chopping block if Medicaid is cut. But I also was just so struck by. There's a book called Inventing the Feeble Mind, The History of Intellectual Disability in the United States. And there's just such a striking passage there. Many children with autism were routinely placed in public mental institutions. In those settings, they languished in institutional back wards where they received no services, educational or otherwise. That's exactly the story of Willowbrook and many others. Amid sterile conditions, only broken by the endless noise of a lone television set and then incoherent cries and noises of low-functioning residents, these children's autism soon transformed into a profound psychosis. And this is just, we probably even should have had a warning at the beginning of this webinar that some of this, is so disturbing and just heart-wrenching to think of this on a massive scale. There was something like 200,000 residents in the U.S. at the peak of the institutionalization, right? Is that a sort of a reasonable estimate?
Yeah.
A lot of them children, a lot of them probably autistic children. In fact, I'll just quickly mention, I also had a chance to speak to Michael Wilkins, who was the original doctor whistleblower at Willowbrook, who was the one who allowed Geraldo Rivera in through the back door in 1972.
Yeah.
And he says that he did not learn about autism in medical school. He did not know even what that was. But now he said as he lies in bed and he is haunted by, the children at Willowbrook, he sort of is thinking, okay, this one in hindsight was autistic and this one was autistic. And we had a whole floor of higher functioning children. A lot of them are probably autistic. So this idea, David, I would love for you to comment on this since you have actually studied institutionalized autistic people. Would love to hear your thoughts on your learnings.
Yeah, I mean, there are two ways that people were institutionalized, and autistic people might have been institutionalized through much of the 20th century. One was in institutions for the feeble-minded, what we now call people with intellectual disability, but the other was through our extraordinarily large psychiatric hospitalization system. At its peak in the early 50s, half of all hospital beds in the United States were psychiatric beds. In 2009, my team was asked to go into a state psychiatric hospital in Pennsylvania to look for undiagnosed autism, and I was incredibly skeptical of this, and also didn't know how we were going to do it for exactly the reasons that Gil describes. These are people who are on extraordinary number of psychotropic medications concurrently, and they are suffering the effects of institutionalization, sort of well-documented set of phenomena that leads to something that looks like psychosis. But we put together a really excellent team in schizophrenia and an excellent clinical team in autism. And we went in, we couldn't interview the patients because they were on so many medications. It was hard to get a sense of clinical presentation. But we talked a lot to the ward staff, and we went through their records. And many of these people had been there for decades. So I'll give you the punchline, which is that 10% of the people that we assessed met criteria for an autism spectrum disorder. None of them had the autism diagnosis in their records, in their current record. But many of them had, because they've been there for decades, we could go back through their records and look at their records when they were first admitted. And one of the children, he was now in his 60s, but was admitted as a 10-year-old to the psychiatric hospital, was diagnosed with autism by Leo Connor. His parents were in Philadelphia. They were, as Gil described, an upper middle class family, and were doing their best to get services and education for their child. He had a lot of he did a lot of finger flapping. He was echolalic. That means if someone asked him, "Do you want water?" he might respond, "Do you want water?" Sort of these classic symptoms from Connor about autism. And the psychiatrist in Philadelphia wanted to call him feeble-minded. The parents disagreed, and they took him to Hopkins to meet with Leo Connor. And Leo Connor diagnosed him with autism and told the family that for the sake of their younger daughter, to save her from what he referred to as social embarrassment, they should either put him in one of Pennsylvania's, quote, many fine psychiatric hospitals, or with what he called a dog patch family that wouldn't be concerned with social niceties, by which he meant a rural family. And I am quoting from his notes. We had his notes within this case. The mother refused to do that, but her son became increasingly violent towards his sister, his younger sister, and ultimately she felt like she had no choice. And so she put him at Norristown State Psychiatric Hospital, where after 10 years he lost the autism diagnosis, because those adult psychiatrists didn't know what autism was, and he was diagnosed with schizophrenia. And he was unresponsive to medications for treatment for schizophrenia because he didn't have schizophrenia. And that's how he ended up on 8 concurrent psychotropic medications, with the psychiatrist's frustration leaping off the page about why he wasn't responding to these medications. We were able to work with the psychiatric team there and take him off his medications, and he spoke for the first time in anyone's memory of anyone who is currently, because he had been there much longer than any of the staff had been. And I am sure that this was not an uncommon phenomenon, right? So in 1955, there were 100 million people in the United States. Almost 600,000 had spent at least one night in a public psychiatric hospital. So more than 0.5% of the United States had spent a night in a psychiatric hospital. This was the way we cared for people with psychiatric disability, just like it was the way that we cared for people with intellectual disability. So I think both ends of the spectrum, both those, with co-occurring intellectual disability and without co-occurring intellectual disability, were probably very highly represented in these institutions. We just did not have the language, and adult psychiatrists did not have the language and the skills and the understanding to diagnose autism.
Mitzi, you wanted to jump in?
Yeah, I did, because this is a story that you can hear in almost every country as we start to look at who is in institutional care and what diagnoses do they have and which diagnoses are actually right. I remember interviewing John Clements, who's a really respected clinician in the UK. He, as a very young man, right out of school, was sent to Ely State Hospital, or Ely Hospital in Wales. And Ely had just had a huge scandal, very much like Willowbrook. Lots of deaths, lots of terrible treatment. The people were dressed out of a bin. You just got whatever you stuck your hand in. So you'd have men walking around in a frock and people in the wrong size clothes, and no one cared, He came in, and I remember him describing it to me. He said the first thing was the smell, and the second thing was the noise. And the third thing was that there were toys that had been donated, and they were up on a shelf in the room. And he said, "Why are the toys on the shelf?" Well, the children don't know how to play. So we put them there as decorations. And these kids had no program. And then he went and worked with the adults. It was even worse. But the kids had no program, no education. And his job was to try to turn it around. And he says, looking back, none of those children had an autism diagnosis. But now that he's worked with many people with autism, he said the place was chock full of autistic children. And these were mostly the children of working class families who had a really different experience of what services they could access. They couldn't pay a dog patch family. They were the dog patch family. And it was, your kid needs to be put in an institution because otherwise you can't work. You don't have a home where you can have a room that would be comfortable for that person. What kind of life are they going to have? Lots of very negative messages that parents got. The other thing that we forget sometimes is that there's been a change in what we expect from children, right? And this has something to do perhaps with the increase in diagnosis. I look back because people always say, well, where was autism? I was in school in the 60s, in school in the 70s. I don't remember anyone with autism. It must be new. I know that quite a few of those children, I grew up in Kentucky, quite a few of them were in the state hospital in Frankfurt, which was an absolute cesspit. It was really bad. It was shut down in 75. And I know because there are records of this, these children then go into group homes. But then I think about others that I knew, who would indeed have merited an autism diagnosis. But at the time, if you could function in a classroom, at least minimally, no one was putting you forward for special services. School could be brutal back then. If you got out of line, you got hit. You would be taken out of the classroom and sent to the principal's office, or worse yet, spanked right in front of everyone, because I remember it happening to me. A lot of kids were living their lives in fear in school. They were barely getting by, but they did, and they could go into the kinds of jobs that were around. In my hometown, you could go work at Florsheim Shoes. It wouldn't matter if you were autistic or not. We're not in that world anymore, and we haven't been for quite some time. So if you have a child who looks like they're not going to achieve basic ways, academically or behaviorally in school, that attention is going to be brought to bear, not just by schools, but by parents who have expectations that my child has got to get something out of this situation. They won't be able to just walk into a job that doesn't require a high school education, or that where it doesn't matter if you're a bit odd. Even being a janitor these days, you have to be able to act a certain way. And those used to be the kind of jobs where indeed you would find people who are undiagnosed, quite able autistics, often very smart people too, working way below their ability, but there were jobs there that they could get. That change in what we expect, I think, has made a difference in who gets targeted for diagnosis. It doesn't mean they shouldn't be diagnosed. It just means that it was easy to overlook it for a long time because there was a life trajectory that would be okay for that person. And I think here of one of Connor's patients who's, been found, and he's still living, I think, who was able to have a life in his hometown where everybody knows him. There was stuff for him to do. He had family managed stuff. He did indeed go live with a family in the countryside for a while, but there was a life for someone who needed repetition, being able to do the same thing every day. It worked for him. And I think the way that our society has changed makes it much harder for somebody who has those kind of traits. And I also see this, I'm teaching global health now. I also see this when I'm working overseas, that these changes are also affecting places like Ethiopia, places like Colombia. It's not the same world that it was 50 years ago. And there are fewer opportunities for people who may be different, who may have different needs, and that attracts diagnosis. We medicalize these differences. Doesn't mean it's wrong. It's just a thing that's happening.
Thank you. No, this is just tremendously insightful. And Gil, I think you had a comment as well.
Yeah, I just wanted to bring us back to the present moment and maybe to underline the obvious point. And I think the obvious point needs to be said. This is what is so insidious about the term epidemic, and what's so wrong about it. Namely, not only that there isn't an epidemic, yes, it's a result of, diagnosis and, etc. We can argue if there's overdiagnosis or not. But also, epidemic is something scary. It's a fundamentally something bad that is happening. And it's completely covering over the fact that there's a really positive story to be told here, that in fact we are doing something much better than, not that we couldn't do better, of course we can, but a lot better than what used to be in terms of treating children with developmental disabilities, whatever they are and however we call them. We're doing something much better, and to call that an epidemic is very insidious. It really kind of loses the achievement that happened here, and that only happened because a lot of parents and some, well-meaning professionals worked really hard to achieve that.
Mm-hmm. Thank you. No, that's so we have about 15 minutes left. I'm gonna project again for any of you who are watching and would like to ask a question. Please text your question to this number, 205-618-1059. And in the meantime, we can maybe briefly cover what was going to be the question for Greg and Colin Killick, who is the CEO of ASAN, Autistic Self-Advocacy Network. He provided some remarks, and the question is whether autism is a disease that requires a cure. And in fact, I was reading this incredible book called Pattern Seekers by Simon Baron-Cohen, and he talks about autism as being something that made us human, how we were able to create complex tools early on, and how we got ahead of the Neanderthals, for example, who could never do that. He talks about Thomas Edison being autistic, and this idea actually resonates. Certainly resonated with me, and it opened my eyes. But this is something that ASAN talked about, and in their April statement, they made it clear autism is not a disease. You cannot catch autism. It's genetic. We're born autistic. We're autistic our whole lives. Autism is a normal part of life. You cannot prevent or cure autism, and you should not try it too. It is a waste of time and money and harms autistic people. And he also shared some, so Colin shared some comments that neurodiversity is an inherent part of humanity. Autism has existed as long as there have been people. It's not a disease that someone can catch, nor is it something that can be cured. It's an inherent part of how an autistic person's brain works from the moment they're born. Autism does not destroy the lives of autistic people or their families. Autistic people are impaired in their ability to perform certain tasks, which can vary hugely from person to person. And some autistic people have significant support needs, but autistic people also have strengths, passions, and accomplishments. And all of us, including those who have intellectual disabilities or are non-speaking, have lives that are very much worth living. Would love to hear your thoughts on this, and maybe also from the perspective of kind of the various aspects, of an kind of the disability aspect for an autistic person. Are we conflating multiple aspects under one term? So, if we were able to um, support and overcome some of the aspects, let's say, of the intellectual disability, um, support people in that, while not claiming to cure the autism, but support their functioning. Is that something that is sort of a distinction that we need to think about? Gil.
So I will preface this that I'm not trying to articulate what ASA and I'm going to say, not at all, and I'm expressing my own point of view. My own point of view is that autism is not one thing. I think it's a label that has been extremely useful. It created this juggernaut that brought together parents from many different walks of life and also self-advocates, and that was able to advocate for children who needed services. But those children are very, very different from one another. And just, we call it a spectrum. I mean, on one side, and I'm trading in stereotypes here, but on one side of the spectrum, you can find somebody who's employed and a little bit quirky and needs to deal with, social issues. And on the other side, you find a family that is saddled with somebody who is, 18 or 25 or 30, who is still not speaking, perhaps is because of frustration, can sometimes be violent, so that can become a problem. The differences are huge in terms of their needs, but also there's no evidence in the research that there is one condition here. There is a behavioral diagnosis that is actually built to accommodate many, many different presentations. And at the genetic level, there is a sea of different mutations, some de novo, some not, all of them accounting for just a very, very small percentage. So it is very likely that in the future, you can carve out certain conditions that become more clearly a particular condition that may have a treatment. So that's why I'm a little bit pushing back against, what ASN is saying is that there's a lot of families, a lot of kids who need treatment and need, their condition addressed. It's not just a difference. For some people it may be, but there's a lot of families and people for whom this is not the case.
Mm-hmm.
I'll jump in and say that I think every person with disabilities needs support of some kind, including my colleagues here at the university who are on the autism spectrum, because I do have some. They also need certain kinds of support, and there are times when they need it very badly, discrimination in the workplace, for example. And other people need other kinds of support, and the label shouldn't be the thing that leads. It should be the support needs of the person. Sometimes there are aspects, because autism comes with other things, right? It often does not stand alone. There are other things that the person may exhibit that do need something that you could call treatment. So someone might have an actual medical condition like epilepsy, which is much more common among people with autism. Of course, you need to treat that. It can kill you and it can make your life very, very difficult. Or like my son, speech therapy would have been an amazing help for him. Not to make him speak, because that was going to come when it was ready, but to give him a way to communicate, which was at the root of the frustration. For us, the big breakthrough was the moment when we had come out of yet another terrible school situation when he was very young and said, you know what? I think these people are full of, you know what? We like him. We think he's a great kid. Let's see what we can figure out to do. Let's try to find some other people who like him too, who can help with education. And that's really hard for people to find. There is a lot of pressure to try to produce a kid who can do all the normal stuff. Sometimes you just have to accept you have been handed someone different, and that's okay. Try to find the things that help them to live a good life, whether they have autism, intellectual disabilities, both, additional differences. Find the things that help make their life good. And this is what I really worry about with this push, this idea of an epidemic and a cure, is that we could lose the funding for some of those crucial supports, which we never had as a family. And I've been so pleased to see them happen. Now that my son is in his 30s, I can look back and go, oh yeah, there were things that would have been so great, like even just respite care, which we never had. But we need to have better support, not less support. And if you put your attention on some idea of a cure or of even differentiating groups and their genetics, we lose that ability to have the funding, because unfortunately, the way the system works, it's either or. And that's the thing that scares me the most.
And that, yeah, I think that it's becoming more clear to me as someone who's new to this area that, yes, we do need treatments, interventions, support, etc. But the goal should not be to take an autistic person and make them not autistic, which is what some of these quack treatments are purporting. We're going to get rid of autism in your child, and we're going to cure their autism. There was one comment I heard, so they can play with the toys the right way. You know, there is no right way to play with toys, and so perhaps you know, that is such an important distinction, that we actually need more support and more research. We just don't want to cure people of who they are. So David had to drop off because he's getting inundated with press requests about Tylenol. What an incredible moment that we're living in. And I think this discussion will be tremendously helpful to people as they process this news. Tylenol is the cause of autism, right? That, I think, we'll be putting this in context and realizing what a nonsensical idea that is. In the last couple of minutes that we have, any comments from the two of you?
Well, I saw that there was a question about what we think might happen after this nonsensical report that we expect. My worry is that it will give credence to some of these people who've always been around the autism world. When mainstream medicine doesn't offer you anything, but you're told you should have something, you must do something, there are plenty of people out there who want to sell you something. That something may be really dangerous. The author of this report has been involved in the past in pushing and selling dangerous therapies, things that can actually harm people. I think it actually harms people to try to make them be someone that they're not. You know, it's okay to line up your cars. You don't have to make them go vroom. That's all right. But the idea that people can be cured and that it doesn't matter what you do to them to make that happen is a very dangerous idea. I also suspect, because of some of the other things that Kennedy has said, his idea of these health farms and all this kind of thing, that we may see a return of some of the abuses that we've seen in other kinds of fix-them facilities for children. There's a whole scandal that not everybody knows about drug rehabs for kids and scared straight programs for kids. And believe me, there are young people with autism who've ended up in those facilities. Horrific treatment, and they don't help. They actually hurt. And some of the same players are going to be circling. You know, they know they've been rumbled over here. They're going to come over here. We've seen it with other psychiatric conditions. Some of the same players who are involved in those abusive facilities are also now involved in eating disorders, Another area where medical science hasn't got a whole lot to offer, the cure rate is not great in mainstream facilities. So you've got alternative therapy people who are like, come to my facility, we'll fix it. And they don't. They do harm.
Mm-hmm.
So that's my fear, is that he will really embolden some of the more harmful people and give people false hope and cause bad things to happen to autistic kids and adults.
Thank you. Gil, any final words from you?
Well, I totally agree with Mitzi. I mean, that is the danger. I fail to see where the Tylenol story goes from here. I think they just tie themselves in a loop over that. I don't see where they can go further. But I agreed with Mitzi that just creates the permissive environment in which many other flowers can bloom, but those are not the flowers we want to bloom.
I personally think that this is a red herring, and in fact, in a Children's Self-Defense podcast, Brian Hooker talked about Tylenol, but he said, but also it will be vaccines. So I think the big news will be the vaccines, and in fact, we think aluminum-containing vaccines more specifically. So mark my words. But this was probably leaked for the press to have something to talk about, to distract them from the real news. But thank you. What an amazing discussion, and hope to have you all back. There's a lot more to talk about. Thank you, and have a great week.
Thank you, Alex, for assembling us.
Thank you.
Yeah, thanks for bringing this talk together.